I am an occupational therapist with more than 20 years of clinical experience. And I also have my advanced certificate to practice hand therapy in the state of California. Hand therapists are physical or occupational therapists who specialize in the rehabilitation and treatment of the arm. So, hand, wrist, elbow, shoulder. So the entire arm and those joints. And my main background is in occupational therapy. So I'll give some general tips as well for pain management. And especially on how to manage pain while limiting medication use. If you are in pain, please see a doctor because a doctor can help you diagnose the uh, the the problem, or the doctor can give you a diagnosis and then refer you on to a physical therapist or an occupational therapist or a hand specialist. So that's me. I uh, I have lived in St. Louis, Missouri for 16 years. We moved here a couple years ago. I love the weather of California. And are most of you from California?
No, some are from outside too.
Oh,
So
okay, okay.
Yeah.
And the best thing that for me here in Cupertino has been joining Dr. Sachin's classes. And he keeps saying that it's a privilege to give. And that's what I've learned, or that was my biggest takeaway. So it's a privilege for me to give any kind of guidance. So let's talk about pain. Pain can have purpose also. It alerts us if we have strained or injured a body part. But if it lasts for longer time, for a few weeks or months, it can lead to suffering. And the problem with pain is it can affect our mood also. So let's talk about non-invasive techniques. So ideally, it would help to see a doctor first and then see a physical therapist or an occupational therapist. So they can give you a customized exercise program because there are no one size fits all treatments because there are so many diagnoses. I see a lot of patients with hand arthritis and carpal tunnel, but I don't even treat two patients with the diagnosis of carpal tunnel the same way. So it is good to see an expert. Now let's talk about exercise. Motion, the biggest mantra for you is motion is lotion. A lot of times when someone's body part gets injured, the tendency is to not move it. If a knee is injured or an elbow is injured, because we try to protect that body part, and that makes that joint, it can make that joint go stiffer and leading to more pain. Let's see. A good, easy uh, things available at home could be a heat pack or a cold pack. If a heating pad does not help you, you can follow the recommendations on the packet of the heat pack. Your physical therapist can recommend other versions of the treatment, like TENS unit and things like that. Posture is huge, especially during this quarantine time. If you are using the computer more than usual, and even your posture throughout the day, no matter what you are doing, whether you're cooking, cleaning the house, please be mindful of your posture. Make sure the height of your desktop monitor is adjusted so the top level of the computer, so the top line of the monitor is at eye level. You can also use ergonomic keyboards to reduce strain on your wrist. For hand pain, you can also use adaptive equipment and orthosis, like jar openers. We also, as therapists, we also recommend splints or braces for hands, which are again very specialized and very customized depending on the need and the very specific diagnosis of the patient. I do not give two exact same splints to a patient with the same diagnosis, for example, carpal tunnel or arthritis of the hand. We dive deep as to what exactly the deeper cause is. Joint protection techniques. Use your joints in optimal positions. Please do not text with your thumbs. I keep reminding my daughter. And try to hold your smartphones at eye level so you do not strain your neck. Generalized relaxation can also help reduce the perception of our pain. So let's say if I'm having severe pain, if I'm relaxed, I may perceive it to be moderate. Or let's say if I'm having mild pain, if I'm very, very stressed, I can perceive it to be moderate level pain or even severe pain. So if someone is in pain, in addition to all the medicines and therapies, trying to practice deep breathing, meditation, mindfulness, or listening to soothing music, anything that you find relaxing can help. Massage. Let's talk about massage. Touch signals travel faster to the brain than pain signals. So rubbing a body part can also help. Let's say if your knee or your elbow is hurting, so just rubbing, if you rub that part, uh, those touch signals are traveling to the brain faster, blocking the pain signals, and they can take the edge off the pain. They will not really help take the pain away completely. I can show you a couple examples of the splints and braces that we give. Okay. Here is a thumb brace. I had made it for someone who was a lot smaller than me for the base joint of the thumb, for arthritis of the base joint of the thumb. And there are store-bought braces as well. But each brace is so diagnosis specific and specific to what the patient does that it helps to see an expert who can guide you. I will share some websites. There's a brace that can help with carpal tunnel. Sometimes the one size fits all store-bought braces don't really help anybody. The pressure in the carpal tunnel is least when your wrist is straight and not cocked up like this or flexed like this. So a lot of people, when they have carpal tunnel symptoms, they go to a store and buy one of the wrist braces, which can actually keep the wrist cocked up. So I've seen even doctors issue those braces. So it really helps to see a specialist. Here's a brace for tennis elbow. But again, a differential diagnosis is very important because some people have radial tunnel syndrome where the radial nerve is pinched here. So these braces can make the problems worse. So it's better not to self-treat. I've seen lots of people just trying to self-treat. Even a couple sessions with a qualified hand specialist may help. I will soon talk about general things that we can do with computer use. But if you have upper extremity pain, it may help to see a hand therapist. I've been a member of the American Society of Hand Therapists for past 10 years. And so you can go to this website. Make a few phone calls to find out if they are doing video visits, if you are, worried with COVID-19, to see a hand therapist or a physical therapist on one-on-one basis. If you have some other kind of pain, like back pain, you may want to see a physical therapist. And here's the website for. Oh, is it backwards? Are you guys seeing it backwards?
Now we can see you well.
No. The letters are there. Okay. Great. Okay. Um, my husband is here to help me with the technological issues. Um, but with his, uh, I see a lot of people from his profession who are computer professionals having lots of arm pain because all the nerves that go into our hand and arm come from our neck. So it is very important to have your monitor adjusted to a good level. The top line of your computer monitor should be at eye level, because if it is too low, you'll end up flexing your neck. Right now, my husband has a big monitor, so his neck goes into extension. So you don't want that either, because nerves can get pinched here. Um, uh, it helps to have a padding for the keyboard, so your wrist can stay neutral, especially for those people who are using computers a lot during this quarantine. Laptops are not really good for neck or arm body mechanics, because the problem with laptops is if you have the screen at a good level, then you have to shrug your shoulders to type. You know what I'm saying? And or if you place the laptop on your lap, then you end up flexing your neck a lot. We have also ordered a sit to stand desk for my husband recently, because like most computer professionals, or even people, other professionals using computers a lot, he ended up with back pain. So this sit to stand desk helps him stand intermittently. There is also an app, Stand Up, that kind of reminds you to take breaks. So it beeps every half hour, just as a reminder for people to change their desk height. And for pain in general, it is we advise people to take lots of rest breaks, no matter what you are doing, especially for seniors. So even if you're cooking or cleaning, after every half hour or so, try to take at least a few minutes of break and do some gentle stretches, which again can be recommended by your therapist, or you can do, these are just general stretches that will not really hurt you, because when we are cooking and chopping vegetables, or if we are typing, our shoulders get rolled forwards. So we call these chicken wings. So we advise people to take breaks every half hour and just stretch like that. You guys are welcome to join me. Okay, please be very gentle with all your exercises. 1, and hold for a couple seconds. And 2, our goal is to stretch the pectoral muscles here. 3, 4, 5, 6, 7, 8, 9, 10. Okay. If you are crunched for time, you can just take a 15-second break every half hour and do only 3 of these. The key is to move the joints throughout the day. Another thing that we recommend is alternate arm raises. So 1, 2, 3. Please do all your exercises very slowly and very gently within pain-free range. Please do not overstretch. So our goal is to move throughout the day. And okay, now roll your shoulders back. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So we are doing all these things to help us work against the forward flex posture that we have while typing or cooking. And you can do these either while sitting or standing. Try not to sit for extended periods of time. So try to get up and walk or at least stand every half hour. Okay. And okay. Now let's do some wrist exercises. I don't want to give too many wrist exercises because those, depending on your symptoms, you're better off seeing a specialist, because too much of movement of the wrist, if you have carpal tunnel syndrome, can actually make your symptoms worse. Let's do some easy hand exercises. Make a fist and open. For all of these exercises, it's okay to do only 3 repetitions. Especially the hand ones, you don't even need to do every half hour. Now bring your fingers close together and spread them apart. Okay, now make a gentle O. You can either slide down the thumb. These are exercises that we recommend to patients with arthritis of the hand. So these are very gentle. A lot of use may be at a higher level to do weights and things like that, but that is not something we would recommend in a group session like this, where everyone's physical abilities are different. You know, we prescribe very individualized exercise programs. I don't treat any of my 2-hand arthritis patients the same way. Really, no cookie cutter approaches. Okay. Now, hold your palms together and bring your wrist close to your body, and then make it move away. Now, we do not want to overstretch, so be very gentle. The median nerve passes like so. This is your carpal tunnel. For any of these exercises, do it within pain-free and stretch-free range. If you want to go past this level, if you have any pain, please consult an expert. And for those of you who have trunk stiffness, even rotating your body gently like this also confuses the brain and decreases the perception of the pain. Again, please don't over twist. Be very gentle. It's okay if you go halfway. I am going to send Dr. Sachin a handout of these hand exercises so he can forward that to you guys. Okay, that's it. So I think, do you guys have any questions? My biggest thing is I see a lot of patients of uh, all ages, and most of them say, I'm so busy that I don't have time to exercise. But the key is take a few, take a 1 minute break every half hour. That way, it will not lead to a bigger problem. It's okay to do only 3 repetitions of 1, 2, 3. I'm just trying to show you how quick it can be. You're still being gentle and slow. 1, 2, 3, and 1, 2, 3. That's it. These are the biggest ones. You can also do pectoral stretches on the door, or these gentle stretches throughout the day will also help. So these 3 exercises for computer use or constant cooking during quarantine will help open up the chest. The key is to do it throughout the day. Every half hour or every hour, very gently. It will not take you more than 15 seconds, and we owe it to our body.